Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Dear colleagues and PGs, today we shall discuss acute and chronic liver failure because of acute hepatitis E. I shall share with you the data from Pakistan, from India, and from the Southeast Asia, as well as international data on these aspects. The acute and chronic liver failure because of acute hepatitis E carries a huge mortality. I'll be sharing the data of the mortality as well as the cases in the last 2 decades. So therefore, it is very important that all the chronic liver disease patients must be vaccinated against hepatitis E because it leads to the acute and chronic liver failure in such patients with a resultant very high mortality. So let's see what is the data on the acute and chronic liver failure because of acute hepatitis E. Till now, we have discussed the acute hepatitis E cases in immunocompetent persons with normal liver, as well as acute liver failure in immunocompetent patients with normal liver. Then we discussed acute hepatitis cases in immunosuppressed patients with normal liver, and then the chronic hepatitis leading to liver cirrhosis in immunosuppressed patients with normal liver. In the last video, we slightly touched upon the acute and chronic liver failure because of acute hepatitis E in patients who have already got a chronic liver disease. Today, we shall discuss this in detail, what is the data, what is the mortality. So, as I said before in the last video, the chronic liver disease can be caused by several underlying diseases, such as chronic hepatitis B or chronic hepatitis C, NASH, autoimmune liver disease, alcoholic liver disease, or hereditary diseases like hemochromatosis or Wilson disease. Acute hepatitis E virus infection in patients with chronic liver disease may result in acute and chronic liver failure. In a large Indian cohort of patients with chronic liver disease, hepatic decompensation due to HEV infection was related to a worse outcome as compared to decompensation due to another cause, and the 12-month mortality was as high as 70%. Small studies from developed countries also report a poor prognosis in patients with underlying chronic liver disease. Patients with genotype 1 and 2, they are at higher risk as compared to genotype 3 and genotype 4. I'll share this one study with you, that is the hepatitis E and acute and chronic liver disease. It's by the Ashish Kumar Vivek Sarwat Saraswat from the India, and which appeared recently. The study giving the meta-analysis of the all studies, major studies reported from the regions. In 2002, from Pakistan, a study was reported 4 cases of acute and chronic liver failure due to hepatitis E in ACLF, and out of these 4 patients, 1 died, so the mortality was 25% short-term mortality. In 2004, 3 important studies have been included from the Vellore, Lucknow, and Delhi, and in these, the mortality was 67%, 14%, and 30%. So again, a huge mortality in patients where the acute hepatitis E is the cause of the ACLF. Then in 2006, again, from Kathmandu and China, important studies were published, and the mortality was 28%, and even 100% from China. All 80 patients out of 107, 80 patients, that is 75%, these were because of acute hepatitis C, and all these patients died. So very, very huge mortality. Then other studies in 2007, 2008, 2009, again the mortality was high from Delhi and Dhaka. Then again from the Lucknow, Chandigarh studies in 2009 and 10, and China, again the mortality being the 44%, 50%, and 34%. Again from India, the Chandigarh, Lucknow and Delhi, Jaipur and Chandigarh, again mortality being very high. So the huge data is coming from the neighboring country, India, where the acute hepatitis E, being the cause of ACLF, when the cause of the ACLF is acute hepatitis E, mortality is very, very high. And the same has reported from other parts of the region as well. Like I shared with you the study from the Kathmandu, from the China, from the Dhaka, and again from the China and from the Egypt. So in all these areas, when the cause of the ACLF is acute hepatitis E, mortality is very, very high. Overall, in these studies, there were the 21% of the all causes of ACLF was because of acute hepatitis E, and these were 471. And out of these patients, 220 they died. 220 they died. So it was the 34%. The median was this. So it is a point to note is that when acute hepatitis E is a cause of ACLF, mortality rises very high. This is another study, and I'll share with you. Again, it is just published this year, a couple of months ago, and this is the acute hepatitis E virus superinfection increases mortality in patients with cirrhosis. Again, this is a very good study and a very properly assessed study, and saying that when the acute hepatitis E superinfects the patients with liver cirrhosis, the mortality becomes very high. Let's see the details of it. Here in this figure 1A, what they have compared the patients with no cirrhosis. These are the patients with broken line and they didn't have cirrhosis, and they have compared this the patients with cirrhosis. This is when the patient has got the cirrhosis. So when they compared the patients with no cirrhosis, and no liver cirrhosis means either normal or patients with chronic liver disease, but no signs of cirrhosis. When they compared them with the patients with liver cirrhosis, the one-day mortality, this is the one-day mortality rate, was significantly high in patients with liver cirrhosis. And this was 23% mortality in patients with liver cirrhosis as compared to those where they were not having the liver cirrhosis, whether the liver was normal or the liver was having even chronic liver disease. And this was 3.8% mortality. So 3.8% 180 days mortality are after 6 months, the 3.8 or 4% of patients of ACLF because of the acute hepatitis C, they died, while as compared to this 4%, 23% of patients with liver cirrhosis, they died. So it was a really very, very high, almost 7 times higher mortality in liver cirrhosis. In this figure 1B, where they have compared the patients with uh, the cirrhosis. This is the red line is for this of the cirrhosis. This is the broken line is that with the chronic liver disease patients, and this is with the normal liver. And what they have compared, then when they compared the normal liver with the chronic liver disease, and then with the liver cirrhosis, the mortality was very, very high, again with the liver cirrhosis, as I already said, 23%, and the patients who are having the normal liver, it was very low. So they divided these patients into two. the patients with the normal liver and with the patients with the chronic liver disease. So the bad is the state of the liver, higher is the mortality in these patients. And these patients were, they were a very huge number of patients, and these were 74 patients, and they have shown that the mortality in liver cirrhosis is significantly high as compared to normal liver, or if the patient has got simple chronic liver disease. This is they have compared the survival curve of 1 day's mortality according to the EASL ACLF patients. EASL ACLF patients with cirrhosis, and according to cirrhosis and EASL ACLF in total patients. So here they applied the EASL ACLF criteria, and what they have found that the 180 days mortality in patients with cirrhosis, this is the line with cirrhosis, was significantly higher as compared to the patients who are not having the ACLF because of the ACLF criteria of the EASL. So EASL ACLF criteria, if you apply for those patients, then again the mortality was very, very high. Even if you go for the EASL ACLF criteria. Similarly here, the 1 day mortality was higher for patients with cirrhosis with ACLF criteria than those with patients without cirrhosis, and for those with cirrhosis without ACLF criteria. So even if you apply the ACLF criteria of the EASL, the mortality is very, very high. And this is very interesting that they have applied the APASL ACLF criteria. And again, what they have noted, then even irrespective of whether you apply the EASL, which I showed you in the last slide, or the APASL ACLF criteria, mortality is the very, very high in patients with the patient has got cirrhosis as compared to the patients who are either having no cirrhosis, or the patient has got the normal liver but the chronic liver disease. So the study conclusion is that if a patient has got cirrhosis, and they compared 3 groups of patients: the patients with normal liver, patients with chronic liver disease, non-cirrhotic, and patients with cirrhosis. And the patients with cirrhosis, they behaved badly. The mortality was very, very high in patients with liver cirrhosis as compared to patients with just chronic liver disease or patients with normal liver. And this necessitates that the patients with liver cirrhosis, especially, and the patients with chronic liver disease, they need special protection against acute hepatitis E, especially in the areas where the hepatitis E is endemic, and the Pakistan, the India, Southeast Asia, China, these are the areas where the hepatitis E is endemic, and we see the endemic cases, especially where there is the rains, floods, just like nowadays. So we should be careful that we may get these ACLF patients in our setup because of the current rains and floods and mixing of the sewerage in the drinking water. So thank you very much. Inshallah, in the next video, I shall be discussing with you the treatment options available, what are available and what are in the pipeline for this acute hepatitis E. And this will be the end of the series of our videos on the update on hepatitis E. Thank you very much. See you till then. Khuda Hafiz.